Thank you for joining me for another episode of Loretta Live, recorded directly from my alma mater, Chapman University. Today, we're going to get into a topic that's got a lot of people in California talking and worrying. We're going to be discussing the Affordable Care Act and what it means to you and your family. My first guest today is Georgina Maldonado, formerly a managing partner at Genesis Consultants, where she specialized in the healthcare field. There's a new player on the scene, an organization called Covered California, a new agency in charge of bringing affordable care to our state. So, Georgina, welcome to Loretta Live.
Thank you for having me.
And you're going to talk to us a little bit about Covered California and what it means and this Affordable Care Act. And can you tell us some of the basics? Because as you know, I was one of those votes that provided us to have this law. So there's a lot of misconceptions about what this is. Can you discuss a little with us? Tell us a little bit about what this is. What is the Affordable Care Act and what is Covered California?
Well, the Affordable Care Act is the law that our President Obama, he signed into law so all of residents in California are able to have affordable health care insurance. And so California has taken the lead in developing a California Benefits Exchange, which is Covered California, the organization you just mentioned. And so Covered California is going to help the residents in the state obtain healthcare coverage. And there's a lot of misconceptions, a lot of, people are afraid, people don't know what's going to happen. However, they're doing a very good effort of doing outreach and education to help individuals understand what this means on a one-to-one basis, but also programs like yours help people guide them through the process.
Super. So let's start with the basics. So we passed this law. It said that in January of 2014, everybody had to have health insurance. Now, who's everybody? Let's begin with that. The law applies to residents of the United States who have been here at least 5 years. So permanent residents who have been here at least 5 years and all citizens of the United States. That means if you're undocumented, that means if you've been a resident less than 5 years, that means if you're here on a visa for 2 years as a foreign exchange student or something of the sort, this law does not apply to you.
Correct.
This is for residents of 5 years at least in the United States or citizens. And so Covered California is the marketplace. It's the place where you go to buy insurance if you don't have it for residents of California.
Yes.
Okay, so what if I already have health insurance because I work for the government or I work for a big company?
Then you should be fine. However, if you feel that it's not affordable for the income that you make, then you can go to Covered California and obtain a more affordable healthcare coverage.
Super. Let's say I work for a small business or I work for myself and it's been too expensive for me to either purchase insurance on my own or my small business boss, he doesn't cover us because it's been too expensive. Where do I go then?
It's a fabulous option to go to Covered California because if you're a small business employer or if you're the owner, you can go to Covered California because they also developed a separate organization that can cover small business owners.
Super.
And so that is also in the
So as an employee, I can wait for my boss to get it for us because it's going to be more affordable as a small business.
Correct.
Or I can get it on my own at the Covered California Exchange.
Yes, if you don't want to wait, then you can begin doing research now and get informed about what the options are and who the plans are in California.
Gina, what if I've had cancer or I have diabetes or something like that and no insurance company will ever cover me? What happens then?
Well, with the new law, pre-existing conditions don't matter anymore. You're going to be able to get healthcare coverage.
Super. And what about if I'm like a mom and I got 2 kids and none of us are insured, or maybe one of my kids was small enough to be on Healthy Families because it didn't cost very much and I wanted to have some health care. But now you're telling me that the mandate is that everybody must have insurance. So starting January 2014, I have to have an insurance policy. Do I have to cover my family too?
Everybody needs coverage.
Okay.
Everybody is going to need coverage.
And what if I go into Covered California? What kind of plans are going to be? Is it going to be a government plan?
Well, and in our next segment, we will be discussing the Medi-Cal expansion. However, for the private plans, there are 4 options here locally in Orange County, which are HealthNet of California, Kaiser Permanente, Blue Cross, and Blue Shield.
Wow, so real companies.
Yes.
I mean, yeah, Blue Cross is,
Yes.
or Kaiser, that's considered kind of like Cadillac nice plan. So that's what's going to be available in those in that marketplace.
Yes, those are going to be your options, and through the website of Covered California, you can begin to do your research as to be able to input your information as to your income, number of family, where you live, and you can begin to do the research. And now, between now and open enrollment, you can have that information, so when October 1st comes around, when it's open enrollment, you know what plan you want to apply to.
Super. And I was told that all the healthcare plans will cover what are called essential health benefits, meaning that once a year I can go in and I can have a physical to see if there's anything wrong with me, have my regular tests like a mammogram, a pap smear, etc., and that I will pay nothing for those tests.
That is correct.
And I will pay no doctor's visit for that.
Part of the law required healthcare companies not to charge their members for those preventative services.
And every plan will have that.
Yes.
Whether it's Medi-Cal, whether it's Medicare, whether it's a large business that I work for, so therefore I get private like that, or any of these private plans if I go into Covered California.
Yes, the 2 biggest things that happen with the law is being able to get those preventative services at no cost, and the other advantage is, as you mentioned earlier, is the pre-existing conditions.
No longer exists.
Correct.
So that's super. And I'm told, I saw those numbers come. I also saw them for New York City. New York State, every state is building its own marketplace, if you will. And if a state doesn't want to, then the federal government will put a marketplace in for them. California, as you said, is leading the way. We put ours up right from the beginning, it's now. And New York just recently also put one up. And they said that the prices on the policies in New York were like 50% less than if you were out in the open market. And I know in California, I saw them, they're anywhere between $54 a month premium to about $350 a month premium. And that's if you have family members and you want a more Cadillac type of a plan, etc. But this is great. And if it's still too pricey for you, depending on how much money you make, the federal government will also subsidize those plans in Covered California. So this is so exciting. And I know, Georgina, that we're going to be talking to you a little bit later on in the program, but I want to thank you for being with us today.
It's a pleasure to be here and informing.
Explaining what's going on with respect to this. And for more information, log on to coveredcalifornia.com. You can see the address on your screen, and we are going to be putting that address up throughout the remainder of our program today. So stay tuned. Next, we'll talk to Ilya Roland of Cal Optima, Orange County's Medi-Cal connection, about some exciting new changes there. So don't go away.